Hey everyone, my name is Vineet Desai, and my industry forecast presentation is on the US physician industry. So what defines the physician industry? The physician industry refers to any primary care doctor, specialist doctor, or surgeon who provides medical care to patients. These could include pediatricians, radiologists, or family physicians. There are over 800,000 active physicians currently in America, with an annual total revenue of over $475 billion. There is an ongoing pressure in America from both government and insurance companies for physicians to not only lower healthcare costs, but also improve the quality of care. Currently, Medicare or insurance plans' fee schedules determine how physicians are compensated for their services. Perhaps the biggest problem in healthcare is the rising healthcare costs, which are distancing many consumers from visiting doctors. In order to be a physician, there are some key skills and competencies that are required. After completing a 4-year undergraduate program, one must attend a 4-year medical school and obtain a degree in either allopathic or osteopathic medicine. Next, each student must do a 3 to 7 year residency in a specialty of their choice. Most residents also go ahead and get a board certification in their specialty, which helps them out with job prospects. Some go ahead and pursue fellowships, which are further specializations in certain areas due to the precarious nature of work and the increased need to specialize in a niche area of medicine. Some key skills for physicians are communication, dexterity, and compassion. One important one in the coming years is knowledge and usage of technology, due to the increased rate of non-invasive biomedical technology development for most medical specialties. There are 3 key areas of technological development in the physician industry: informational technology, biotechnology, and the doctor-patient interaction. One company I may pursue an HOD internship for is HealthStream, that is developing new software to increase the efficiency of electronic medical record documentation. In biotechnology, progress in cancer nanotherapy, CRISPR gene editing, and portable biosensors is working to make medicine cheaper and less invasive in the coming years. Finally, projections show that in the next 5 years, there will continue to be a prolific growth in telehealth, or digital doctor-patient interactions and consultations that improve healthcare access to remote areas. By 2026, the overall employment of physicians is expected to grow 13%, with average revenue across all specialties growing at an annual projected rate of 3.3%. The figure below depicts projected employment across an array of different specialties. Much of the increase in demand for physicians is due to an aging population as well as an increased demand in rural or low-income areas. By 2030, there is even a predicted shortage of 41,000 to 105,000 physicians. Furthermore, in regards to business-related changes in the physician industry, many physicians are predicted to lean towards forming group practice associations, where they can counter the growing rate of healthcare costs by sharing staff and medical technology. One major contributor to the changing landscape of the physician industry is demographic changes. With a 38% increase in individuals over 65 by 2025, and therefore increases in obesity and chronic diseases due to a longer life expectancy, there's a far greater demand for physician services in the future. In addition, the growth of a racially and ethnically diverse America has raised the need for doctors with greater cultural competency for more diverse patients. I chose to look closer into the changing face of radiology, which is a medical specialty I am particularly interested in pursuing. I also received a chance to interview Dr. Mark Sobel, a pediatric radiologist at Overlake Hospital in Seattle. Radiology has a 14% projected increase in employment by 2026. Dr. Zobel told me that radiologists are requiring greater understanding and experience in automated technology and software such as optical coherence tomography, image segmentation, and computer programming. Listed below are some great tools and resources that I will use to keep myself updated on technological, socio-economic, and educational developments in the physician industry. The American Medical Association has a journal that lists recent advances in medical technology, and the American Board of Medical Specialties has news updates for each medical specialty. First Research has some great frequent news updates on socio-economic topics in medicine, while Science Daily is a great resource for articles on novel technology that impact physicians' careers and necessary skills. Dr. Zobel also recommended the journals listed below as great resources for reading up on radiology and new technology that is impacting the entire field. Thank you so much for listening.